communication delays, as well as voice and stuttering, and a host of other areas that we work on. I have my bachelor's is from Berkeley, and I graduated with master's from Cassi Alter in communication disorders. So briefly, I just want to quickly go over the scope of practice, because when you think of like speech therapy, oftentimes what comes to mind is fixing an S, fixing an R, fixing an L. So I just wanted to kind of give you an overview of all the different areas we look at. So you'll have, maybe look at the things going on with your kids in your classroom, and be maybe a little more perceptive to some of the areas that maybe they could use a little help with, or also may fall under the scope of our practice. So first of all, of course, speech. Let's start with the one, as I said, we're probably most familiar with. It's articulation. It's how the kids are making their sounds. So again, all kids, about a 3-year-old is not expected to be perfectly clear, probably about 70 to 80% clear. And I want you to know that a sound is really only considered delayed if they should have had it already and they don't have it yet. So if you have your 3-year-old and they don't have their shoulds and their chuds and their J's and their R's and their L's, and sometimes they're reducing their consonant blends, is this child going to sound so clear? Are there going to be many other kids in the classroom that sound clearer? Absolutely. But the truth is, I see a lot of those 3 to 4-year-olds, and oftentimes, I'll give the parents a home program, I'll try to give them things to work on to move it along, but it wouldn't constitute a delay. So it is important to have in your mind, and I'm certainly glad I have to email you, any of you, a norm chart, particularly on what to expect of each age loosely, so you'll have an idea of what you can do. And also, you can always reach out to me, and if something is of concern, I can maybe tell you a little bit how to get it going and how to get it going with the parents so you can get it started. That running for intervention is not always the first step, that you have some information. Okay, under the guise of speech, I also want to point you out to oral motor and feeding issues. So if some kids are coming into your class and you're seeing when they're eating and they're more sloppy or they're drooling a lot, and also their speech is not as clear, that is another, little red flag that you may want to say there's something a little bit more going on with this kid than with the others, and possibly draw the parents' attention to it to get it looked at. Okay, let's move on to language. Language is a whole ball of wax, truthfully. It's the content of the speech. It's how they comprehend language, how they're expressing themselves. It includes the syntax, the vocabulary, but also a whole other area that we look at is their pragmatics, which is their social use of language. So if you have a child, sometimes they'll get a call and they say, well, a child, he doesn't follow directions, right? I tell him X, Y, and Z, and he just doesn't seem to know what to do. So it'll seem like he has an auditory comprehension problem, correct? But a lot of times, it could be when we're evaluating him, we're seeing that actually his vocabulary is quite good and age appropriate, and where he's breaking down is in terms of his comprehension of grammatical structures. So then we know, we gotta teach this kid, when it's like, if you are finished with your worksheet, then pick it up, bring it over there, and then you will be ready to go outside. I mean, that's kind of an embedded clause in terms of a grammatical clause, which many kids will understand, of course. So when we're looking at that in terms of language, we're trying to peel apart all the layers and shine our light on the different things that would constitute good comprehension and good expression for their age, and then determine if there are some weak spots where we can build them up in those areas. Now, pragmatics, which is the social use of language, has gotten a lot of attention lately because we're much more aware of kids who are falling on the autism spectrum disorder. And again, 20 years ago, we didn't look at this so much. Like, some kids would come in and they would seemingly be, like, if we would test them, their comprehension was good. Technically, the content of their language could be good in terms of vocabulary, syntax, narrative skills, but you just saw that these kids were off in terms of their use of language, their functional use of language. When they're sitting and playing with other kids, they just don't seem to be able to take the turns, to respond in the correct way, or to have the eye contact and the turn taking, and all these things would fall under the area of the pragmatic or the social functional use of language. So we want to look at that also to help those kids along. Okay, moving on to voice. Voice is something, again, we would look if the kids are getting hoarse all the time, if they're losing their voices all the time. Another thing is resonance, which really would pertain a lot more to the populations that you work with. These kids that oftentimes are not so clear with their speech, we're very focused on which sounds aren't they making, they can't execute the movements, quick enough, if they sound kind of, slurry. One component, though, that can be overlooked is their resonance, which is the quality of their speech, the ability for them to project. So if you look at these kids and you say, oh, I don't understand what they're doing. Is this a kid that's always stuffed up? Does he have a lot of ear infections? Is his nose always running? And then Addie's not clear. I just recently had a child who came for an evaluation because he's not so clear. I take one look at this child and I see, and he's very congested with his nose, but no ear infections. You hear the history did not have ear infections. But I said to this mom, I said, listen, I would like, just so I know we've covered all of our bases, I would like you to take him to an ENT and just see if there's fluid sitting in his ear. Because the child can have fluid sitting in the ear and they're not sick. They're not pulling at their ear. It could just be sitting there. And it's like they're underwater. And between the ages of 0 and 5, even a 10 dB hearing loss, which is just losing that little loss in terms of hearing, really is shown to affect their articulation and their ability to learn sounds and produce them clearly. So we want to look at that factor. Again, when you make these recommendations, you're not diagnosing. I'm really careful to say, I'm not saying, this is why this or that, but I just want to be sure. So in this particular case, lo and behold, I could have told you, if any of you have kids, and you just know this is all kind of connected, I would have been shocked if honestly, if she had told me that he didn't have the fluid in his ears. So that was definitely impacting his clarity, and this type of child, by the way, you give them tubes, and within a few weeks, it tends to clear up dramatically. So keep an eye on that. Which brings me to our last